Thanks, everyone. I'm just going to check to make sure this is all working. Yes, it is. Look, I think there's a lot of great conversations around technology, and I'm not going to be able to match the likes of Tesla and Google's and Hyperloops of the world. For me, it's more focused around how can we get the best out of this technology and service for healthcare? And hopefully, there are some principles that we've kind of come up with that could be of use to you guys if some of you guys are actually developing products in your own right. So, fingers crossed, it's all working. There you go. I'm going to kick off actually with a personal story. Last year, I found a little lump in my eye, and it's just this weird little thing that was going on inside of it. So, as you can imagine, go to the doctors. They have no idea, so they decided to send me off to consultants, and I had everything: the MRI, the X-rays, the serious conversations, just trying to work out what the hell it was. Fast forward a couple of weeks later, and I'm sitting down in the doctor's office, and he's sort of waiting for my results, and the doctor arrives with panic in his eyes. So you can imagine I'm starting to freak out a little bit here as well. He sits me down and apologizes profusely because he'd actually misplaced his external CD-ROM drive, which is where the X-rays were kept, so I couldn't have actually access to the findings from the test results. And what kind of freaked me out, really, I mean, obviously my eye was fine, my heart probably needed looking at, but the thing that astounded me was there was a lack of sophistication from all these clever people that are looking after my health, and the fact there was no integration between the healthcare services. And actually, things, the sort of technology that was sort of looking deep into my eyes, the only way you could see the output of it was through a piece of technology that should be firmly in the history books. And I think that was the kind of challenge for me, and I think we really wanted to think about why that was the case. And I guess think about your experiences when you were in the doctor's surgery. Do you feel that it's a similar experience? Do you feel there's a lack of technology in the room and probably a lack of engagement? So, if we were to look at this challenge, I mean, if you look at it in the broader sense, actually the healthcare industry is at a really exciting time. There's lots going on. It's bigger than banking. There's robots attacking cancer. There's, I guess basically all sorts of things that are really helping you achieve the very best in healthcare technology. But the problem is all this pace of innovation is fantastic, but the incredible technology is not necessarily being transferred into an incredible experience. So at Jack Morton, we thought we'd try and look at ways of making that better, and we thought we'd partner with people like Telstra. And one of the exciting things is I always say that innovation and healthcare is obviously a really cool segment to work in, and obviously that's really a good one to sort of deliver upon. But basically, how do we get the best out of health organizations? How do we get the best from this technology whilst providing a user-friendly manner? And the key thing for us is about actually looking at it through the patient lens. But first, we're not medical experts, as James alluded to. So Jack Morton's a brand experience agency. We look after, big opening and closing ceremonies for Olympic Games, and then little things like this, like the Lego launch in Times Square. But in between that, we do look at service design for brands, and that's why we felt it was appropriate to have a conversation around this opportunity. And Telstra, as we all know, they connect us to the things that we love and help us enrich our lives. And really, that's where the excitement was, about merging this expertise together. So what are some of the challenges? Well, as I've alluded to, science and technology is evolving at a rate of knots. But the problem is that we're living in a connected age with disconnected systems, and that's a real problem for us. And there's also plenty of obstacles that just getting in our way. We've talked about the lack of accurate patient records, access to physicians. These are challenges that really stopping us from having the best possible experiences within healthcare. We're also drowning in a lot of information, and as Jane alluded to, we all sort of opt to go to Google first and foremost before we go to anywhere else. In fact, apparently, the Minister for Health in the UK now is encouraging people to go to Google first before anywhere else to self-diagnose. And I think that's pretty scary, to be honest with you. In fact, I think in the UK, actually nearly 20% now are actually self-diagnose. And obviously we know because we're stopping us from actually getting to the doctors fast enough. We're getting problems with inaccurate information. But frankly, Google is also trying to make us feel smarter than what we appear to be. And that overconfidence is actually quite scary and very dangerous to all of us. So how can we improve the accessibility? How can we improve the connectivity in the technology so that we can decrease the self-diagnosis and hopefully increase the accuracy? The industry has responded to this. There's a lot of organizations and widgets and all sorts of things to try and stop us from self-diagnosing and hurting ourselves, actually. But the problem is all it's doing is making it worse. I mean, if you look at this guy, you know, the healthcare.gov was a complete disaster in its implementation. And the main reason is they didn't think about the user itself. The tools didn't fit the needs, and it left everyone in the US feel pretty terrible about themselves. And if you sort of look at it, the context of that then is stuff like this is just stopping us from actually experiencing the amazing advances in sciences that, you know, I'm sure some of you guys are involved in and some of those things that people have been talking about today. So one of the big things that we find is that, you know, we've got to work out where's the perfect opportunity to take advantage of this. As patients, we actually think that healthcare organizations have a responsibility. So they have responded to that. You know, obviously Obamacare wasn't necessarily the best possible example. So there are lots of little programs right now from the likes of Pfizer and so on that are trying to respond to this challenge. But the problem is, whilst there's 76% of us are aware that they have a responsibility, only 20% of the market are actually aware that it exists or that we actually engage with it. So why is that? Why is there a lack of engagement in all these services? And the big challenge for us is that it's not necessarily looking at it in the context of a proper patient journey. The whole patient journey is completely flawed. So like a tube map, we know that there's lots of entry points and exit points. So when we're looking at the experience design for some of the things that you'll see as I sort of talk through some of those examples, there are actually a lot of problems occurring. There's four in sort of, if we think about some of the patterns, there's four in total. If you look at the lack of input, so it's too much of an emphasis on the physician and not necessarily thinking about the critical support staff that could help implement and empower the individuals to get the best out of their experiences. It's too narrow as well. So, you know, when you think about the journey, there's a long journey for therapy, but it really thinks about the focus on, I guess, one moment in time. Also, it's too limited. It doesn't necessarily reflect the twists and turns that you go through as you start to get better from a serious condition. But also, it's just too simple. It doesn't necessarily integrate with the wider community. So, yes, you've got the medical experts, but what about your family? What about your friends and the physiotherapists and all the other people that will help with your therapy? So the classic journey is no longer linear. We all know that it's an ecosystem, so we need to remap this and think about all these different touch points, but with the patient at the heart of everything that we do. And the other thing that we've got to remember is that we've got to forget the pill, because therapy have parity now. You know, one paracetamol is exactly the same as the other. So actually, when you think about it, the experience is actually the therapy. So let's emphasize on the single item, and let's think about the holistic journey. So if we're going to redesign it, we decided that there are four sort of key principles to adhere to. And so I wanted to just share those four with you and think about some brands and businesses that are doing it well. And you'll notice there's a lot of crossover, which really goes to show how well designed these offers are. So the first one is about adding value at every level. So what we mean by that is that we've got to improve lives at every single stage. And a great example of that, I think, that thinks about the healthcare industry holistically is the Langone Medical Institute and the Medical Center. They've got just a very simple palm scanning technology. Can you imagine when you go to the hospital, every time you go in for repeat visits, you're always a stranger, and you feel like you're always completing endless paperwork. What these guys do is you put your hand on the technology, and it brings up a beautiful integrated record. So not only have you got your mugshot on there, you've got your billing information, your insurance details, and also all the bloody x-rays that you've been involved in. So you can imagine that would have been amazing for me during my experience. The other example, I think, is just a very basic but very wonderful offer, is the pill pack pharmacy. So I think it's fair to say that in the pharmaceutical world, it's pretty much very transactional. And I think the future is all about coordination. I think in the US now, I think it's about 10% actually take more than 10 meds a day. So you can imagine the complexities around that. So to have something that's so simple is quite exciting. And I think this is why this organization is doing so well. The second one's a bit around building around the user. So we kind of know in product design world, this is what we feel is quite important to us. But I think it's fair to say that there are times where when we design these experiences, we don't necessarily think about what really is relevant for the user themselves. This is an example of a client of ours, AbbVie in Chicago, and it's for rheumatoid arthritis sufferers. And it's a simple device where you inject yourself. And what we've done is, with working with the business, there's a simple audio file that's embedded into the device, so it gives you step-by-step instructions to administer the drug. So you can imagine, for people who have to do it quite regularly, it's quite scary and quite daunting when you have to do it for the first time. The third example is about crafting communities. And when we design experiences for brands, it's quite important to look at the way communities work, really more for around scale. But on this occasion, it's more about how patients can feel connected. They can share information, learn from each other, and feel that they're not alone when it's a pretty scary time when you're suffering from a serious condition. So this first one is another example that we've done with Eli Lilly, and it's just a simple online forum for children who are suffering from type 1 diabetes. But it really considers more than just the child itself. It thinks about its wider community, its parents, the teachers, and even your school kids. So there's a lot of online gamification and coaching and so on and so forth. Another example is with Novartis, this Living Like You program for multiple sclerosis sufferers. But what I love about this is that you've got these sort of life hacks and things like that, but there's a section on the future. And if you're suffering from a serious condition, you don't really think about that future. But here, they're trying to bring that to life in a beautifully engaging and simple tone of voice. The fourth one is about being human, and frankly, in our world, particularly in marketing, it's quite an overused terminology, but I think it's fair to say in healthcare, there's still a lot of work that needs to be done. You're kind of talked at directly from the textbook. It's quite a lot of complicated jargon, and we've talked about the challenge around empathy and people staring at a screen when they should be engaging with you in the doctor's surgery. A lovely brand that's in the US is called Zoom Care, which started out as a preventative healthcare industry, has now created this integrated healthcare offer. But what I found interesting with these guys is that they actually developed their services through personas. Now, in product design, we develop personas all the time, but in healthcare, the whole notion of healthcare is about democratizing and being readily available for everyone. So it's kind of interesting to design something that's so specific in a world of healthcare, which should be readily available for everyone. And just another example, which I kind of love and always enjoy looking at this, is GE's Adventure series. And it's just a great little example of being able to think about something, a problem empathetically, and the kids and the parents and the family have to go through these serious illnesses, and to sort of take advantage of some of the fantastic stuff that GE are working on. So look, I'm going to hand over to James now, and James is coming over from Telstra Health. There's a lot of these examples talk about stuff that we've done around the world, but what's exciting is that Telstra Health are actually doing it here in Australia, and I wanted to sort of share some of the insights of what these guys are doing locally on your doorstep. So I'll hand over to you.
Wonderful, thanks Vinny. Look, first, quick disclaimer on Telstra Health. We're not about selling phones and internet to hospitals, which is what I think most people will probably think of. We're about transforming the way healthcare connects through technology and through data. We know, though, that we can't do it in isolation, and there's no use us designing it the way that it's always been designed. So there's no lack of innovation in healthcare at the moment. There's a lot of digital tech startups operating in that health space. Latest Startup Health Insights report from the US says there's around about 7,700 digital health startups in the world. The problem, though, is that they continue to operate in the way that the health systems operated in years past. So they operate with the GP silo, in the radiologist silo, in the hospital silo, in the aged care sector, and none of it connects together. So at Telstra Health, when we were designing our business and thinking of the opportunity that we could capitalise on, we knew that we had to do something different. So we've gone out, we've invested around about $250 million to date in 18 different acquisitions or partnerships with digital health solutions right across the health system. And that's everything from Health Engine, which is an online booking service, which to date there's been 2 million appointments booked with GPs, dentists, chiropractors and physios, through to Redicare, which is our telemedicine service, which allows Australians access GP care for scripts, referrals, treatment, diagnosis and advice anywhere in Australia 24/7 using phone or video. through to Fred IT, which is a pharmacy electronic prescription service with 750,000 electronic prescriptions done every day in Australia. During peak times, it's about 25 prescriptions a second. So they're changing the way that healthcare is done across those sectors. And our journey and ambition for the next step is to then start to integrate those solutions together so that you as the patient, the technology can match your experience across the health system, not the practitioner or the provider's experience in the health system. In terms of building it around the user, we also know that we can't develop this in an ivory tower outside of the health system and do it in isolation. So we tend to work with providers, and a good example of that is the Royal District Nursing Service in Victoria. Came to us in 2014 and said, look, we've got this real problem where our staff travel 10 million kilometres a year. They spend 70% of their rostered time behind a wheel, and half of the time when they're going out to visit a patient, it's to simply supervise them to take medication. There's got to be a better way. So we worked with them to come up with a solution called My Care Manager, and it integrates telemedicine, home health monitoring, and patient medical records, none of which are new in their own right. They've all been around in different formats for some time. But before, the nurses had to use 3 different programs to be able to do it, separate screens. It was very complicated. The patients who were using it are generally in the older age group, not so familiar with technology. And it just wasn't working. The technology was there, but it wasn't usable. We integrated into a single, easy-to-use solution for both the provider, in terms of the Royal District Nursing Service, and for the patient. So it was a tablet for the patient, wireless system, single press button to operate, and was able to really come through and deliver a solution that met the needs and was built around the users on both sides there of practitioner and of patient. And that's just some short footage of it there. But then in also doing this, we know that chronic disease in particular is a huge growing factor in Australia. We know Australians, 1 in 2 Australians have at least one chronic disease. 20% have more than one chronic disease that they're suffering or living with at the time. So we're building a solution there that ties in especially some of this GP chronic care disease management plans, pharmaceutical records, and also hospital records for regular users of the system through a thing called we're working title of a health gateway or patient gateway. Again, not revolutionary in itself there, but the aspect that we're really excited by is that it's going to be open and it allow for other people who are suffering from those same diseases to share information, to have conversations, and to share news stories. So if you've got diabetes and you've got an ongoing chronic condition, you need to know how to change your lifestyle, where's research at, where's the thinking at, you've got that opportunity and ability to adapt and share those news with people who are in the same situation as you. And then finally, in terms of how we've gone about it and trying to be human, when we first started up and for the first year or so, I'd ask people in our even senior leadership team and say, what does Telstra Health do? What do we do? And I'd get different answers from everyone. And there was a lot of tech jargon in there. There was a lot of medical jargon in there. But it was a matter of actually bringing it down to language that people could understand. So we wanted to make it serve for all of our customer bases. So whether you're a patient, you're a doctor, you run a hospital, or you're the Federal Health Minister, we want to make healthcare easier for you through the use of technology. And that's in terms of providing access, of lowering costs, increasing convenience, and delivering better health outcomes. And I think it took us a long time to get that language down pat, and largely because it needed to be something that could apply for all of those different audiences, and yet still speak in a human way and try to get across some of that message. So we're very much still early in our journey. It's really exciting being part of the startup within a big company like Telstra. We're not finished, and we've got a long way to go, but it's a really exciting start.
So obviously, the healthcare is massive business. I'm sorry, I put that on there because what I really wanted to say is don't let the tech take over. If we can do it, if we word it just right, it gets angry. But it's massive, massive business. Clearly, there's a lot of progress going on, but we've still identified lots of different experience gaps. And I found a story someone told me a few weeks ago about a lady whose father was ill, and he kept missing his appointments. She lived on the other side of the country. He couldn't drive any longer, and he hated public transport. So all she did was set up his appointments and get him to the doctor's surgery on time through Uber. So the experience gap is transportation, and obviously Uber was the simple tool to fix it. Funny enough, I just read this morning there's a new offer now, a new product called Pager, which is kind of the other way around. You get the doctor to come to you. The challenge is there's a huge cost implication, something like $300-400 a pop just for a visit. But it just sort of gives you lets you think about sort of what sort of technology is appropriate, just to ensure that it actually enhances the experience. But basically, you know, we are fully engaged in healthcare. Apparently, Deloitte was saying that 44% of the market now has highlighted that we are no longer passive recipients of treatment. So we have health kits, we have Fitbits, we have home DNA kits. We've all got a role to play to be able to make a wonderful experience within the healthcare. We still go to retail stores and we expect the same delightful experiences. So there's lovely technology like this, and that's fine if you can have that, but it's got to be able to benefit us on our day-to-day lives. So if we are going to be successful, we've got to work out how we can be mobile first, how it can actually fit in with our digital lives, and how it can be on demand, as if we were to experience a retail environment. I think that's all from us, so thank you so much for your time. Appreciate your time.